sure you would have expected the big crowd request by open ophthalmologists here, both for the sake of getting this done on their own eyes and also to know how to make money, I suppose. So, thank you once again, Dr. Narayan, Dr. Mathur, and Dr. Prasad for lovely presentations. And I'm more or less going to repeat what Dr. Mathur has said to an extent what Dr. Narayan has said. But this is what I limited myself to providing service to the presbyopic age group in my clinic. And I simply, beyond knowledge, either, like Dr. Mathur said, either a laser or a lens, the two things, no confusion. But it all depends, like Dr. Narayan said, how do we stop these people coming back fighting with us? How do we make them happy? That's the million-dollar question. So what I did in year 2009, I went to Professor Reddy's, Dr. Mathur was saying, to Bogota, and got very impressed with the intercar, and I bought the machine. And after doing a few cases, I realized, first of all, it's limited. Like all the variabilities that Dr. Mathur has said, there are what we call non-responders, but in reality, it doesn't work in certain situations. So I ended up realizing the money I've spent, which is about 2.8 crores, is wasted. But fortunately, that led me to the Supracar and also to the Victus. So started realizing it's not money all the time, we have passion as well. So here, if you notice, in the Supracar is born out of intercar, because the Technolos has their own Presby LASIK, which has a transitional zone, which has become a major issue for them. And they realized they needed to learn something, and they have learned something from the intercar, that you could come out with a nomogram that will give you an ablation without a transitional zone, and end up calling it as Supracar. So these are all the eyes I did, and except for the first 5 patients, this is what I want to strongly share with you. First 5 patients were bilateral, and then I realized it doesn't work once again. You know, they all become myopic. They are very, very happy with their reading abilities, but every one of them complained about their distance. From then on, it is nothing but monovision, monovision, monovision. Whatever you want to do, that's how I provided service, and patients are quite happy. And rest of all the eyes are done unilaterally in one eye, and some PR case. And this is the kind of ablation profile you get in post-operatively, that you don't see a transitional zone. So this is one of the first PRK cases I did. So PR Supracar can be done both in LASIK and also in a PRK situation. So in conclusion, I would say it's an excimer presbyopic solution. Without the transitional zone is the attraction, ablation optimized. And that's what made me buy this technology. And seeing that the patients are happy with this, what I call an advanced monovision, meaning in the dominant eye I correct whatever power they are, and if they are emmetropes, no need to correct anything. But in the non-dominant eye is where I do my Supracar. And Dr. Narayan has touched the word counseling. You know, however much he counseled himself, still there are issues and patients may not be happy. So counseling really is the king. It is what you make them believe and what you deliver. And what Dr. Prasad did, you know, almost all your patients are happy. Am I right? So once again, it's monovision. Am I right? So it's all, at the end of the day, we're still living in the world of monovision. We give it different kinds of names, but that is the most successful way to provide a laser treatment for a presbyope, is monovision. Then I realized that the story doesn't end there. It's not enough to stick with the laser. Like Dr. Mathur has divided into different age groups where you go in when it comes to counseling, which one would you offer, whether they have, I mean, a person like me, I have no cataracts, but just before I broke my leg. In fact, went for surgery to Dr. Steve's leg in US, and that is for my dominant eye. I wanted then accommodative IOL, and in my non-dominant eye, I wanted a multifocal. I won't name the lens because people may not like it. But this is what I want. But this is what I have in my clinic, all this technology. The mixture of all this technology. Now, unlike in the past, I can confidently say to my patient, I will deliver the goods. Everybody know what the patients ask. They ask for zero. So with phaco techniques, I'm able to do it. Phaco techniques is the word that I coined in myself. It is nothing but phaco, but a technology mixture of 5 different technologies. I use the Victus, femtosecond laser refractive cataract surgery outside the theater, then take them inside, do the Stellaris mix, followed by the Matrix Cora, and with a premium IOL. By then, you cracked it. But let us say that even then there is that some residual power and the patient is not happy. After 3 months, I take them back to my laser room and do a synaptic LASIK. So, why are we doing all this? Well, the reason is expectations. And the amount of marketing that we're all doing, whether you're a single-handed practitioner or whether you're a corporate person, you're all into big-time marketing for freedom from glasses for LASIK, and that's crept down to the presbyopic age group, and older guys like me also want to be without glasses. And then ophthalmologists, of course, are perfectionists. They like to, unlike other specialties, like I said, I repeat it, my fractured leg, this little bit this way, that way, the bone will still mount. That's not the case in a posticapsular rupture. So ophthalmology is a different surgery, and having done general surgery, orthopedics, neurosurgery, and also aviation medicine, I am the man to compare. And I can vouch that eye surgery is different. So here is a small video of what's happening in my clinic. And basically, it's like I said, it's a technology mixture. First, of course, is the Victus. Second is the Stellaris mix. I really want to share with you about the WaveTech intraoperative aberrometry. It's really made my life very easy. The Victus machine has a microscope attached, so I can do even the pediatric cases as well. That's the greatest advantage. I've already done about a few pediatric yesterday. I presented some of the challenging cases. And then we move the patient into the OR after the Victus and then get on with our routine phaco MICS. And you can see the WaveTech Aura attached to the Zeiss microscope. So after the posticapsular polishing, it will actually give you the spherical power, the cylinder, and the axis. And it's wonderful because it's great for toric IOLs, it's great for post-LASIK procedures. I almost stopped my crystal lens accommodative IOLs because of disease syndrome, capsular contraction issues. But I'm back again with a wonderful capsulotomy because capsulotomy is the most important thing with accommodative IOLs. And I'm back again and I'm using the crystal lens like I said, and this is what I would like to have it done for myself in the dominant eye, crystal lens, and in the non-dominant, of course, a multifocal. So, believe me, because of WaveTech Aura, and the surgery is refractive, I could produce some excellent results. I could give them, if I want, minus 0.25 or plus 0.25 or 0 or whatever, clinically you think is beneficial. And when you're counseling, you do choose the patient. If it's a housewife, I don't mind putting multifocals in both, depending on their need. So basically, these are lifestyle procedures, and you need to, in your counseling, find out the lifestyle of that particular individual to see whether they would like to, which is more important. Usually they say middle, intermediate, and distance, everything is important. But then, having gone through few of these cases with the laser, there is a learning experience for all of us, and I learned, and after 3 months, I take them to the LASIK room, and then, of course, I get along with the. So, see, before I never used to put a multifocal in a cornea which is thin, because I will not get the opportunity to treat the residual power post-operatively. Now with the WaveTech Aura, it is different. I mean, this is what I'll quickly go through. What it does is intraoperative refraction, and you get excellent accuracy for excellent outcomes. Now, what I noticed is before this, there are a lot of enhancements. I mean, for my multifocals, I used to treat the residual power after 3 months. But now, it has dropped down almost from 40% to somewhere around 8 to 10%. So that is what is making my patient and myself happy. And if you look at this in a post-LASIK cataract, before this I was using a special formula, which is also great, but not as great as this. You can notice the bottom line. Post-op AR is giving a minus 0.25 and an uncorrected distance visual acuity of 20/20. So the whole thing is done within a matter of 30 to 40 seconds. The measurement goes to US, and this is the formula I was using before. Very simple formula from a lady ophthalmologist from Sweden. And but still, with the WaveTech Aura, it's brilliant. I got Aura since 2012 in my clinic, and we've done few patients. And if you look at again the bottom line here, in a toric situation, you can see minus 2.5 diopters of toricity, and at the end, that is the result of both the eyes. So we used to get, all of us still get this from Alcon, but with the Aura, this is what happens. You get this picture on the screen to tell you how to, it says rotate clockwise or counterclockwise. All you need is a little bit of rotation and read it again, and then it says no rotation recommended, and it will tell you how much cylinder is left, about 0.27. You should be happy with that. So with that kind of system, what are all the values to our practice? Risk, mitigates risk, of course. It's a new opportunity. We're all passionate about technology, and technology that helps. Aura helps you not only in routine cases that I do, but in post-LASIK cases, in toric IOLs, also long and short eyes, it's extremely accurate. So really it reduces your chair time and it enhances the happiness of your patient. So I got it in December 2012. Like I said, it moved from 40 to 70%. So in conclusion, I would like to share with the previous speakers that yes, either you provide a laser or you provide a lens. Two solutions to get rid of your presbyopia. And what I noticed with the phaco techniques, brilliant results I got. But still the $1 million question remains, all this at what cost? We don't know. But I'm sure technology is never there to stop. When I started LASIK in 94 in England, and when I came to India in 96, everybody thought, who would buy that? No patient would have it done for that price. When I priced it at 30,000 rupees. But here we are, everywhere there is LASIK.